Summer has arrived in the Northern Hemisphere. As lockdown restrictions were relaxed in the UK, people took advantage of the warm weather at the beach. But an outbreak in the city of Leicester is worrying Dr. Bharat Pankhania, a former consultant in communicable disease control at Public Health England. Do you feel that the UK eased the lockdown restrictions too soon, too fast?
Oh, without a doubt. I have been saying this from the moment Prime Minister Johnson said we're going to lift the lockdown measures. The number of cases in the community has dropped, which is good, but it hasn't carried on dropping. It has plateaued. Secondly, we are not testing extensively. On top of that, for control measures, you need to be able to identify the cases and their contacts.
Across the Atlantic, American health experts are also concerned that political leaders rushed to reopen. Now states that eased lockdown restrictions earlier are seeing a surge in new SARS-CoV-2 cases. Is America seeing a second wave, or is it still part of the first wave?
This really is still our first wave. So a lot of the reason we're seeing these increasing cases is because we never really fully contained what was going on initially. And so we opened up too quickly. And now we're seeing the after effects of that. We're seeing cases go up. We're seeing healthcare systems becoming overwhelmed again.
Dr. Krutika Kupali is an infectious disease physician who's been helping communities and healthcare officials better prepare for COVID-19. President Donald Trump said cases in the US are going up because we are testing far more than any other country. So how much of the surge can you put down to increased testing?
Oh, I don't think that the increased number of cases are all due to increased testing. Maybe some of it, but really, as we see more people being admitted to the hospital and more people requiring ICU beds, that is definitely not a function of increased testing. That is definitely a function of more cases. And the other thing you have to look at is you have to look at the percentage of cases. And so the percent is going up. And also you have to look at what is going on with testing. So with testing, really, if the outbreak is appropriately controlled, as you continue to test, you should see the numbers actually go down. But that's not what we're seeing here. We're seeing, as we continue to test, the numbers go up.
Many American states have paused reopening plans as cases rise. Are we going to see waves, or is it always going to just be this constant surging of cases?
The hope is that we get things down to a point where we can have things like good testing, contact tracing, with the ability to do good isolation and quarantine, so we don't have these surge of cases. The mainstay of any infectious disease outbreak is being able to test, being able to trace, and then being able to effectively isolate and quarantine. And that's really what we need to be able to do in order to have a good, robust response, not just here, but all over the world.
Public health officials in the UK are watching America closely. We've heard officials in America say that they're concerned that if cases keep surging, that they'll never get it under control. What are your thoughts on that?
Yes, I'm very concerned about that, and not only for the United States or the UK, but for poorer nations. And I'm almost convinced, in fact, I'm pretty convinced that the coronavirus, as it is, will become an endemic strain. What I mean by that is that it is persistent. It persistently circulates in our population. And then we will have to get used to living with this virus because it will persistently always be ever present and circulating.
He wasn't surprised to see the virus outbreak in Leicester, but he is concerned how slowly the government was to hand over the data they'd gathered in the area to local officials.
The people in Leicester, the officials, the officers, were unaware that the number of cases in the community had been creeping up and had crept up significantly, and they were blindsided by not knowing this. We should have the data in real time in both places.
Dr. Kupali understands people's need to return to normal, but says the easing of restrictions must be careful and deliberate. She co-authored a paper exploring what the Ebola epidemic taught medical researchers about viral outbreaks, lessons that can be applied to COVID-19.
The Ebola outbreak in DRC that started in 2018 today was declared over after almost 2 years, which is a wonderful occasion for the people of DRC and everybody who worked on that outbreak. I think one of the key points that I always tell everybody is that it shows how important it is to invest in global health and research and development. And then I think the other thing that's very valuable would be the importance of community engagement. There was a lot of community resistance in this particular outbreak. And if it hadn't been for the wonderful frontline workers who put themselves at harm's way, working to engage the community and educate them and doing contact tracing, we would not be where we are today, able to say that that outbreak has been declared over. And the cornerstone of that Ebola outbreak has been testing, contact tracing, and education. And I think people really can learn a lot of lessons from that.
After months of lockdown, scientists around the world have noticed pandemic fatigue. And Dr. Pankhania believes this has been compounded in the UK because the government's advice to the public hasn't been clear enough.
I'm very concerned that we will undo the economic cost, the hardship, the pain of the lockdown. This can be undone very, very quickly. It's a very fragile achievement to have brought the case numbers down. It is fragile. And for us to encourage people to say, the mixed message is, go to the pub, enjoy a drink. That's not what I am out for. I'm saying the message should be, the virus has not gone out. We're lifting the lockdown. We want you to be measured and careful. Please be careful, even if you're having a drink.
What can we learn from the surges that have happened in communities?
So the science is very clear, and it is not difficult to explain, which is, if you act fast, if you act early, if you act in a timely manner, you can achieve control.